HER2CLIMB was a relatively large international trial that enrolled over 600 patients, where all patients were treated with trastuzumab and capecitabine and randomized to the addition of tucatinib or placebo. All patients enrolled had prior exposure to trastuzumab, pertuzumab, and TDM1. And very importantly, all patients were required to undergo a baseline brain MRI at study entry. And patients were allowed to enroll if they had brain metastases that were stable and treated, which is a common eligibility for a trial such as this in this space. However, what is unique about this trial is that it also allowed for patients who had new asymptomatic brain metastases or previously treated brain metastasis that was now progressing, as long as they did not require urgent local therapy. So these patients were also allowed. So it's really important to highlight that the trial eligibility really included a very high-risk patient population to come on study, those who had been heavily pretreated, and also those who had either a history or active presence of brain metastasis were allowed. The trial, the HER2CLIMB study, met all 4 of its endpoints: progression-free survival, overall survival, progression-free survival in the brain metastasis patient population, as well as the objective response rate. When tucatinib was added to trastuzumab and capecitabine, we saw not only an improvement in progression-free survival, both in the overall population as well as the brain metastasis patient population, but we also saw an unprecedented 4.5-month improvement in overall survival among all patients, and again, highlighting that this was a very high risk patient population. So this is very substantial. The benefit from tucatinib was noted across all of the clinically relevant subgroups, and there was also a near doubling in the confirmed objective response rate with the addition of tucatinib.
So in the clinical trial, patients had to receive trastuzumab and pertuzumab, as well as our traditional second-line regimen, which is TDM1. The FDA approved this regimen after 1 line in the metastatic setting. And I think the implications are a couple-fold here. One, I think the FDA realizes that we're using some of these drugs in the earlier settings now, including pertuzumab in the neoadjuvant or adjuvant setting, and or TDM1 in the adjuvant setting based on the Catherine data for patients that did not have a pathologic complete response to therapy. So I think it allows us to use it in that post-pertuzumab, post-TDM1 space that may not really be third line anymore. And the other thing it gives us some flexibility on is for patients that have brain metastases, and we feel very strongly that we want to have a regimen that we know is active there, we may not have to march through all of these required priors and may be able to use it a little bit early than we otherwise would have.